So today's topics will be discussing what is the normal functioning of GI tract in first. I'll brief it a bit. After that I'll tell you regarding heartburn or gastrointestinal reflux disease, then peptic ulcer causes and other topics. So first thing, here you can have a look at this is all digestive system. You can see right from the mouth till the rectum, it is seen, it is shown over here. So first thing what happens during digestion, with the food particles we eat like chapati, rice, these are big particles that cannot be digested in our body as it is. So in order to break down that, our body has this mechanism called the digestive system. So with the help of teeth, we break down the food particles into smaller particles, and you can see these are the three glands: parotid gland, sublingual gland, and there is one submandibular gland over here. So these are the glands, they secrete certain substances called as a salivary amylase. So normally you call it as a saliva. So it mixes with the food particles which are already being chewed by the teeth. So it becomes more palatable. So you can see there is a long tube called as esophagus, which is normally called as a food pipe. Just in front of that, I'd like to tell you one thing. There is something called as a windpipe or trachea. Many a times you must have heard somebody have eaten a peanut, a child probably, and that goes into this lung directly and it's causing pneumonia. Your doctor must have told you. So how does it happen? So when we eat, when we chew the food pipe opens and the windpipe closes. So in some circumstances, if you are eating while lying down and some other conditions where your muscles are not proper functioning, so that time the food, instead of going into food pipe, can go into windpipe. So that will lead to pneumonia because of the obstruction. The food particle will lodge into the lung segment, and that will cause pneumonia. So from esophagus, the food comes into the stomach. You can see the stomach, which is lying over here. So before that, I would like to give a brief diagram over here. Suppose this is our body cavity. This is from neck, and this is the lower part where the leg starts. So this body cavity is divided into two parts by the muscle called as a diaphragm. This muscle helps in respiration also. So this is like curved over here. So this is divided into two cavities. The upper one we call it as a thorax, and the lower one we call it as abdomen. In thorax, the vital organs like lungs are situated, a pair of lungs, okay, and this is the esophagus. Here is this opening for the esophagus to enter into the abdomen. And this is stomach. So this is esophagus, or we call it as a food pipe. So from when the food particles are being chewed and it's mixed with salivary amylase and all the stuff, then it slowly comes down, and so on. So here, this is called as a Gastro esophageal junction. That means it's a stomach, which is called as a gastrium, and this is esophagus. So at that junction, there is one wall, or there are specialized muscles called as LES, or lower esophageal sphincters. So what is the function of this lower esophageal sphincter? It acts as a gatekeeper. So when these food particles, they come, so they come over here, and after coming over here, this sphincter, it gets opened, allowing the food particles to go into the stomach. So what is the importance of this LES? I'll tell you. See, when these food particles are coming to this side, it acts as a one-way wall. One-way wall means food particle or anything can come from this side to this side and not other way around. What will be the effect if this comes back? This comes back, that is heartburn. So you might feel that when the food is here, we're not feeling heartburn. But when it is coming back, why should we feel heartburn?
Because it contains acids.
Yeah, that's very right. Because here in stomach, in order to digest proteins and fats, certain acids are secreted. Acids and pepsinogens are secreted. So with the help of that, the protein particles and the fat particles, they get digested. So once the food enters over here, there is a secretion of acids and all the other enzymes. It gets mixed with it, but here we have this lower esophageal sphincter that is acting as a one-way wall. You can consider it as, if you go into the mall, that is Big Bazaar and all the stuff, there is one entrance and there is one exit. So the guardman will not allow you to go back from the entrance. You will be allowed only to come inside, right? So, but here in GERD, or simply the heartburn, what is happening? Because of some reasons, this gatekeeper, that is LES, is weakened. That is weakened, so it is allowing the food particles which are mixed with acids and the enzymes to come back to here. So if it is coming back here, then what is happening? See, if this food particles coming back here, see, in normal people, some of the time it comes back. Normal, in our cases also, many of the time it comes back. But this is the distal part. This is means the end of the esophagus where the stomach is starting. So up to this part, it's okay to get it over here. But after certain period or in certain conditions, the food which is mixed with acids and all is coming back all the way here. It's going upward, upward, upward. So see the cells over here. Anything, see, this is esophagus. If this is the lining, particular lining means certain types of cells are lining this lumen. This is hollow tube, so it will be like lumen. So this will be, if you consider this, it will be lined by certain types of cells. So when it is coming here, okay, up till here it's okay. But when it comes here, above this thing, so then what happens? The cells or the epithelial cells over here, or the lining cells, they try to adapt. By adaptation means what happens? See, from here food is going where? Stomach के बाद food कहाँ पे जाता है? Intestine में, okay? So this is duodenum, this is small intestine, this is ileocecal junction, and this is large intestine, okay? From here the food is going where? Intestine में जा रहा है food, नीचे जा रहा है. But then it is mixed with acids and all, so small intestine can bear it because the cells are specialized over there, so that the cells can handle that much acidic food and all. But what about this? This is not supposed to handle it. This is not see, if a person is doing a regular work, अगर उसको 100 push-ups वगैरह कराएंगे तो he'll fail, right? 10 push-ups he can do, but after that he'll fail. So same function is here. Here the first body tries to adapt it. So by adaptation means what happens? कि यहाँ पे जो type के cells है, I mean not here, in the intestine, the types of cells which are present in intestine, that is bowel, small bowel, similar type ये copy करता है यहाँ पे कि भाई if this person can handle it, I'll also handle if I make the same changes, right? Copy करता है, इसको copy करने की कोशिश करता है. So then that will be intestinal metaplasia. Metaplasia means now this has changed its structure so that it can handle particular type of acids and foods. So after that, if it is long standing में तो फिर वो भी it will give up. It will give up and it will cause dysplasia. Pardon these terms, I don't know exactly what is these terms will be explained properly. I cannot, I know these names only, pathological names only. I'll try to simplify it as much as possible. After the metaplasia, dysplasia is there. Up till here it's okay, we can handle it. We'll have some symptoms, heartburn, acidity, you will feel heartburn, सिर में बहुत जलन हो रहा है. You will feel it. But after this is going dangerous. यहाँ पे it can turn into cancer. So that is a part of it. So coming to this GERD or heartburn. Food particles are coming here, and here the mucosa or the lining which is there, which is not as effective as this one in handling the pressure. So you feel the burning sensation. Typically it's like acid which is कुछ जल रहा है ऐसे. So we'll feel that heartburn. So this is how the heartburn is present. So what happens to LES or ये जो wall है यहाँ पे or the gatekeeper, what makes it weaken or what weakens it? See, if you see in the people who are much obese, in obese people, or you can say heavy weight, whatever, in that thing what happens ki the gastric volume increases. In this thing, this is a hollow organ. Hollow means what? It's like a food, it's a pipe. Pipe में अगर आप ज़्यादा पानी में डालते हो, it will bulge ना, but it can accommodate it. So like that, due to the overeating and all, this bulges, इसका size increase होता है. So this size is increasing, so it is causing increased gastric volume. Volume is वो जो है उसमें एक particular बैठता है, that is gastric volume is increased. There are certain diseases called as myopathies. Means there is a generalized weakness of the muscle. All the muscles tend to be weak. All the muscle. This is all what? This is muscles only. But they are specialized type of muscles. Sphincters are specialized type of muscles. They do not act on our wish or our will. They act on their own. Then drugs. There are many drugs which causes heartburn or which weakens this sphincter. Drugs like in old days for hypertension, used to prescribe calcium channel blockers, nifedipine and all the stuff. Then other drugs are there which are smooth muscle relaxants, which are particularly we are taking. So these are the drugs which can weaken this sphincter and causes